Can you guys hear me?
Yep.
Loud and clear.
Yeah.
Thank you.
This is Chris, just sound checking. We're good?
Sounds good here.
Chris, we did hear you.
Good afternoon, everyone, and welcome to the Tuesday, November 10th COVID-19 response update. I'd like to welcome our panel today. We have Dr. John Weisman, Secretary of Health with the Washington State Department of Health, Lacy Fehrenbach, Deputy Secretary of Health for the COVID-19 Response, Department of Health, Dr. Kathy Lofy, State Health Officer, Department of Health, Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases, Department of Health, Dr. Anthony L.T. Chen, Director of Health, Tacoma-Pierce County Health Department, Dr. Jeff Duchin, Health Officer, Public Health, Seattle and King County, Dr. Chris Spitters, Health Officer, Snohomish Health District, Michele Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, Washington State Department of Health, Dr. John Lynch, Medical Director, Infection Prevention and Control, and Associate Medical Director, Harborview Medical Center, Dr. Kira Mauseth, Behavioral Health Strike Team Co-Lead, Washington State Department of Health, and David Postman, Chief of Staff, Office of the Governor. To begin today's briefing, I'll open with remarks from Dr. John Weisman, Secretary of Health.
Great, thank you, Corey, and thanks everyone for joining us on our weekly briefing today. We're coming to you with an immediate sense of renewed urgency for what we are seeing as increased cases here, which Kathy Lofy will be talking about and showing you on our slides really soon here. We are really concerned at this point with what we are seeing in the trends and believe that immediate action is needed now to flatten the curve. We've been talking with you about the fall surge now for a number of weeks, and we're seeing an acceleration of that. And we think, the most serious consequences are yet to come from this virus. And if we don't act, those can be severe. So we don't want this to take a toll again on the state's economy and on our people, and really need everybody pulling together to flatten the curve once again. I'm so pleased that joining us today to give us a insight from what's happening in the hospital, Dr. John Lynch, as was said, and 3 health officers from our public health agencies to talk about what they're seeing and the importance of our messages. So Dr. Chris Spitters from Snohomish, Dr. Jeff Duchin from King County, and Dr. Anthony Chen from Tacoma. So with that, Corey, I will turn it back over to you.
Thank you, Dr. Weisman. Next, we'll go to Dr. Kathy Lofy, State Health Officer.
Thank you, Corey, and good afternoon, everyone. I'm only going to show you a few slides today since we have a large panel, but just give me few seconds to share my screen. Can you see it, Corey?
Yep.
Yeah. Great. So the first graph I'm going to show you is our epidemiologic curve of confirmed cases over time. And you can see that the number of cases per day steadily increased starting in early September, and that lasted throughout most of October. But what's very concerning to me about this particular graph is that there has been an accelerated growth in cases during the past 2 weeks. As you can see that the slope of this line has changed. And these past 2 weeks don't even yet represent complete data. So at this point in time, we have the highest number of cases that we've ever had, and our case counts are accelerating. So unfortunately, this accelerated growth in case counts is widespread, occurring in both Western and Eastern Washington, as shown on the two graphs on the left, that have essentially become vertical during the past 2 weeks. As a reminder, the graphs on the top represent Eastern Washington data, and the graphs on the bottom represent Western Washington data. And you can see that the middle graphs, which represent total daily tests, have been nearly flat over the time period where we've seen this explosion in the number of cases. So this is not due to increased testing. This is a real increase in disease. You can see on the right, in the right-hand graphs, that hospitalizations have also been increasing on both sides of the mountains, but particularly in Western Washington. And since our case counts are accelerating, I'm afraid that our hospitalizations will soon accelerate as well and overwhelm our healthcare system. And you can start to appreciate in the Western Washington graph that it looked like hospitalizations were increasing at maybe a little slower pace than they have been more recently, but it's a little bit hard to tell at this point. So lastly, cases are rising among all age groups, which indicates that transmission is very widespread in our communities. And it also indicates that we'll see significantly more hospitalizations and eventually deaths since our older age groups are affected. So we're really at a difficult time in this pandemic. We're fatigued, and we've already made a lot of sacrifices this year, but we cannot give up. We all need to do our part to flatten the curve once again. This includes being vigilant about always wearing a mask whenever we are around people outside of our households, and strictly limiting contact with people outside of our household. Ideally, we should probably all stop socializing for the next several weeks to try to slow down the disease that's rapidly spreading through our state. But if you need to socialize, please limit your social contacts to no more than 5 people outside of your household per week, and keep your social interactions as short as possible. So I'm particularly concerned at this point about a surge in hospitalizations that would put strain on our, could put huge strain on our hospitals and overwhelm their capacity. And we're at the point that if we cannot change the current trajectory of disease by changing our behaviors, we'll need to take actions that will hurt our economy, and no one wants to do that again. So with that, Corey, I'll hand it back over to you.
Thank you, Dr. Next, we'll go to Dr. John Lynch.
Thank you very much, Corey, and thank you, Dr. Lofy and Dr. Wiesman, for inviting me to participate in today's briefing. My name is John Lynch. I'm an infectious diseases doctor. I'm based at Harborview Medical Center and part of the UW Medicine System. And like most clinicians, clinics, healthcare systems, and hospitals in Washington State, we've been dealing with this pandemic since the beginning of the year, when Washington State had its first patient up in Snohomish County in Dr. Spitter's jurisdiction. Hospitals have been working very, very hard since then. Healthcare workers have been obviously the most important part of that work, and have developed really good systems, processes, policies, and responses to peaks and surges that we've experienced over 2020. We've all been thinking about what this fall surge was going to look like, and we've all been preparing for it. And now that it's here, we really need to make that call to action. And, you know, as someone who works in a hospital and in clinics, I share Dr. Lofy's concerns about the trajectory of the numbers we are headed in. When you think about some of the big areas that we've, you know, really spent our time preparing, it's around stuff, space, and staff, right? So staff is obviously the most important part. And when we think about the impact of increasing hospitalizations, right, that's about taking care of patients with COVID-19. But an important part of that is you need healthcare workers to do that. And healthcare workers live in our communities. And when we see high numbers of COVID-19 cases and transmissions happen in the community, that threatens healthcare workers. And we need those folks to be able to come to work and to continue providing their care and doing the jobs that they need to do to provide the much needed access to care for everyone in our state. But they've also been backed up with lots of work around surge capacity, around the materials, PPE, and all the other tools that we need to do to take care of not only patients with COVID-19, but all the other medical issues that healthcare systems, healthcare workers, clinics, and other healthcare providers have spent their lives preparing to give. So we also want to recognize that we don't want to go back to where we were in the spring. We recognize that a lot of care was deferred, and we really want to maintain access to care, to all care, pediatric vaccinations, labor and delivery care, cancer chemotherapy, chronic disease management, surgeries and other procedures that need to happen. It is very, very important that we empower our health system, healthcare providers to continue providing the care that they want to care, that our citizens need. And to do that, we need to take actions now in the community to maintain that capacity within health systems and keep health workers safe in the community so they can do the work they want to do. So I just want to echo Dr. Lofy and Dr. Weissman's concerns and their call to action. We need to really be stepping up around our masking, around the physical distancing, reducing time around other people, and that may be stepping away from things like restaurants and bars and other congregate areas to order to get a handle on these cases. We know what interrupts SARS-CoV-2 transmission. We know what stops COVID-19 cases. We just need to actually do it in a widespread fashion throughout our state in order to blunt this curve. So we've also learned a lot in the medical community about how to take care of people with COVID-19. We're able to provide safer and better and more effective care to people in clinics, in emergency departments, in acute care floors, and also in ICUs. Despite learning a lot about this and having more tools than ever in order to take care of patients, people are still getting very, very sick. They're ending up in the ICUs and they are dying. And these folks are not just the older folks. They're not just our elders. They span the entire spectrum of age groups. I have colleagues at Seattle Children's Hospital who have babies and young children, COVID-19 in the ICU. And here at Harborview, we have folks in their 30s, 40s, and 50s in the ICU who have COVID-19. These are preventable infections. These are preventable illnesses that are obviously tragic for the individual and their families and their loved ones, but are unnecessary impacts on our healthcare systems and interrupt the ability for us to deliver care to everyone else. So we just really want to, again, emphasize we want to maintain access. The way to maintain access is to keep our hospitals running, to keep our health workers safe, and that's all dependent upon the steps we take in the community. Because if we don't get a hold of this, all of this preparation, the stuff, the space, the staff, all the work that folks have done will be moot and will not really end up working for all of us as we wish it to happen. So thank you.
Thank you, Dr. Lynch. Next, we'll go to Deputy Secretary of Health, Lacy Fehrenbach.
Thank you, Corey. I want to start by acknowledging that our usual briefing is on Wednesday, and we're meeting today with you because of the Veterans Day holiday tomorrow. I want to thank all of the veterans across our state and their families for their service and for protecting our freedoms and for protecting our democracy, and give a special recognition to the many, many veterans who have been part of our response on the public health side and healthcare side here in Washington state as we respond to this pandemic. Whatever service you've given, we are extremely grateful to it on behalf of the nation and our state. Related to this, Washington State will be observing the federal holiday tomorrow, and that means we will not be updating the Department of Health or risk assessment dashboard or otherwise publicly reporting cases, hospitalizations, or deaths tomorrow. Thursday, we will go back to our regular reporting and we will include these data in that update. We will be able to provide a separate estimate for the number of cases that would have been reported on Wednesday for context. It is important to note that the decisions we make about our public health policies and the direction of our state's response are informed by multiple types of data, and importantly, the trends in those data, not a single day. Our most essential time-sensitive activities in the response will continue tomorrow. I want to assure you of that. These are things like testing, contact tracing, and isolation or quarantine support. These activities are carried out 7 days a week and will go on. They are critical for our strategies to contain the virus or box it in. Turning back to the surge, I'm sure many of you are wondering what we do now with holidays approaching. We know that informal gatherings are contributing to spread already. Our neighbors in Canada celebrated their Thanksgiving about a month ago and saw large increases in cases following that. We cannot afford this in Washington State. Any in-person gathering is risky right now, both for the health of those that attend that gathering and because it can further accelerate the spread of the pandemic. This includes Thanksgiving. The safest Thanksgiving is one celebrated only with the people in your immediate household. You can certainly link in your extended family by web if you want that togetherness, but this is the safest option at this time. For those of you that want to have a small Thanksgiving, please make it outdoors. Please limit it to no more than 5 people outside your household. And you should seriously consider a full quarantine for the 2 weeks prior, which starts very soon. This means only leaving your home for essential things like groceries or prescriptions, or a brief walk around the neighborhood. When Thanksgiving is here, go outside, stay 6 feet apart, and please, please wear masks. It's important to remember that we can get COVID from people we know, love, and trust who may not yet know they have it or be asymptomatic. You could also consider skipping the big meal and focus on a different activity like a Thanksgiving stroll or a chat around the fireplace. To close, we strongly recommend that Washingtonians consider alternatives to gathering in person ahead of and during the Thanksgiving holiday. You can find some creative alternatives at coronavirus.wa.gov/gatherings with an S. We know that folks are done with COVID and looking forward to the holidays, but COVID isn't yet done with us, and it doesn't take holidays. It is more important now than ever that we come together to protect the health of our loved ones, keep our healthcare system from becoming overwhelmed, and save more lives. Back to you, Corey.
Next, we'll go to Dr. Kira Mauseth with the Behavioral Health Strike Team.
Good afternoon, everybody. Thanks for coming. I just want to start sort of by echoing the comments of the other panelists and say that, the exhaustion that we're all feeling in Washington State is incredibly real right now. People are just totally overwhelmed and tired. And pandemic fatigue is something that is widespread, and we're just over this, right? But as Lacy was mentioning, it's not over us yet. So we need to keep vigilant, and this is the time to dig deep. It's really difficult to sort of leverage the psychological and the behavioral resources that we have left, but that's exactly what we need to do. And it is something that's possible. And all of those kinds of things and all of that effort and that focus will help prevent even more of a crisis right now. So when our brains get really tired and on a neurological level, it makes it really difficult to make careful, rational decisions about safety and health. We're more likely to be impulsive, and it's just a lot harder to sort of concentrate in that way, but that is what we need to do. All of us have a strong desire and even a need, sort of on an emotional level, to have a fun holiday season, to be joyful, celebratory, and as close to normal as possible. But the temptation there then is to downplay sort of the risk and to minimize some of the risks that we all have right now going into this season in an attempt to get that kind of normalcy. So this means that we might find ourselves not wanting to mask up, not wanting to say no to something that we might otherwise realize is not safe. It's exceptionally hard, but the diligence will pay off. This is just one of those times. And it's going to keep us all healthy and keep our loved ones safe as well, as what's been mentioned before today. Another thing that's special to this time of year is to consider the likelihood of a bit more substance use, an extra glass of wine at dinner, for example. When we drink a little bit more than we otherwise would, just as an example, our level of impulsivity tends to increase. So we may make decisions under those circumstances that we wouldn't otherwise make in terms of safety. And it's really critical not to let our guard down and to be aware that sort of by and large, like risk management decision making isn't as locked down as it would be when there aren't substances involved. So something else to remember. And then just thinking carefully about decision making. Plan ahead, take as much time before the holidays are here to make a plan that works for your family. Be creative about that and not to do it impulsively and at the last minute. We're less likely to be safe if we make a plan at the last minute. So we can still have that connection. We can still really have those great joyful moments with people, but we need to do it safely. And that's it for me today.
Thank you, Dr. Mauseth. Next, we'll go to Dr. Chris Spitters, Health Officer, Snohomish Health District.
Thank you, Corey, and thank you, Secretary Weisman, Dr. Lofy, for inviting me to participate in this important message for our community. Here we are now, almost 10 months after we first brought you news of the first COVID case ever detected in the U.S. here in Snohomish County. In the months that followed, our communities and businesses sacrificed a lot to help get the cases down and ease the pressure on our healthcare system. Unfortunately, too many people are getting tired of, and for some, increasingly frustrated with the ongoing need to follow public health interventions to prevent spread of the virus. And while that's understandable, in one sense, recent data is now highlighting the severe consequences of that. In Snohomish County, we've seen a shocking increase in our 2-week case rate. From October 31 through November 7, we saw a 50% increase in the 2-week case rate from 125 up to 189 cases per 100,000. Countywide, test positivity has more than doubled in the past month and is now around 6% countywide. Our largest clinic system had a 10% positivity rate last week and showed 15% positive over this past weekend. Cases in long-term care facilities have increased from a few per week to over 20 per week during the past month. The number of COVID patients in Snohomish County hospitals has almost doubled in the past 7 days, from 25 to 44 as of this morning. 6 of those patients are on mechanical ventilators. These numbers are below what we experienced last March and April, but they are rapidly advancing in that direction. With hospitalizations generally trailing 2 to 3 weeks after transmission occurs, the recent spike in cases suggests that we are in the beginning of a surge in demand for hospital care that may become overwhelming, and I would submit will become overwhelming if we don't change our course immediately. Not after the holidays, not next week, not tomorrow, now. I'm hearing concerns from our healthcare system leaders about ongoing staffing shortages, making it difficult to provide the acute care in these settings, even at current levels of occupancy. Consequently, regional hospitals are already developing contingency plans for such an event. This affects not only people's ability to get care for COVID, but also for other urgent needs like heart attacks, strokes, cancer diagnosis, and surgery. If you don't find this information reassuring, that means you're paying attention. We are deeply concerned about an impending crisis, and you should be concerned too. While I think we are already in the beginning of such a hospital surge, and alarm bells do seem to be sounding, I believe that with a concerted effort, we can alter the course we're on now. My request of you is simple, if not difficult. But any mandatory restrictions will be far more difficult for all of us to bear. Holding gatherings is a threat to all. Stop it. Plain and simple, just stop the gatherings. Make a bubble of the same 5 or fewer social contacts outside of your household and stick to that. When is more okay? Not at all in the immediate future. And I endorse Dr. Lofy's suggestion that if you can do it, make it 0 people. outside your household. Reduce socializing and other non-essential activity. If it's not for work, school, or medical purposes, the safest bet is to skip it. Don't attend gatherings, period. Avoid contact with people and businesses who don't follow the guidance. Before you stands or sits a panel of physicians, health officers, and other public health professionals warning you that if we don't take action immediately, even more painful and difficult interventions are inevitable. I strongly recommend you take their advice for your own good and, more importantly, for the entire community, depending on you to do so. Back to you, Corey. Thank you.
Thank you, Dr. Spitters. Next, we'll go to Dr. Anthony Chen, Director of Health, Tacoma-Pierce County Health Department. Dr. Chen, we don't have any audio for you.
How's that? Is that better?
Perfect. Thank you. Continue.
Okay, great. Thank you. So here in Pierce County, we're seeing the same rise in disease transmission as is happening in other counties. Pierce County's rates are up dramatically since June and again since mid-September. We've reported over 100 cases in 11 of the last 14 days, including a record 226 on Saturday. That is 15 times higher than we saw in June. Our 14-day total case rate was 16 per 100,000 in June. It was in the 50s in September, and today we're reporting 198 per 100,000. So that's 12 times what it was in June and 4 times what it was in September. You've heard from our colleagues about hospital occupancy, but then you also heard from Dr. Lynch that it's not only the beds are available, it's the number of staff that are available, and this is challenging. So we need to think about what is important for us. Clearly today you have heard it is important for us to protect the health of our neighbors and our community and make sure our hospitals and clinics are able to handle that. But I also hear from parents and teachers about how important it is for us to have children in school for their educational, emotional, and social needs. We hear about the need to keep businesses alive. And we have to realize if we want that, we're going to have to work together. We know that we can do this. We brought cases down in April. We brought cases down in August. And we need to continue to find ways, despite what you heard about the COVID fatigue and everything else that we're struggling with now. No one thing appears to be driving up the numbers. We see increased transmission in community settings, high numbers in households, but there's no one big event that we've been seeing in Pierce County, and I don't think we've seen that statewide either. We're just seeing more cases in households, among friends, childcare, social gatherings, any place that people are where they're not wearing masks, maintaining physical distance. I know all of your lives are different, just like mine. I work remotely most of the time. I limit my social visits to only seeing my parents. I worry about my mother. She's been hospitalized 3 times this year already. My father's in his mid-90s, and a COVID-19 infection would kill them. I worry about my son and my wife and my medical colleagues in the clinics and hospitals. They're on the front lines. They risk infection daily, and they're facing burnout. And as the weather gets colder and the holidays approach, we must all take precautions to reduce the risk. My brother wants to spend time with my parents because it's going to be my dad's 95th birthday on Thanksgiving. And that means I've had to very consciously think about how I'm going to participate in that. And I'm not going to be at their table in person. And, all of us need to think consciously about that. We need to limit the length of time we spend together, the number of people. Everyone should be wearing face coverings, staying 6 feet apart. And our common challenge is the coronavirus, and we must work together. We know, as I said earlier, in April, all our residents stayed home to control the outbreak. In August, the residents again stepped up and added face masks to their daily efforts to bring cases down. With this third surge, we must recommit to wear masks, limit travel and gatherings, and keep physically distanced so that we can make progress and keep what's important for us. Thank you.
Thank you, Dr. Chen. Next, we go to Dr. Jeff Duchin, Health Officer, Public Health, Seattle and King County.
Thank you, and good afternoon, everyone. We're here today as public health professionals and healthcare providers because we are worried. We're worried about the direction we're heading and the increasing impact on the health of our community, our healthcare system, and our economy. We heard about the pandemic fatigue that we're all experiencing. I'm certainly fatigued, and I want this to end. And I understand that it's hard to make sacrifices when things may seem okay in our own personal circles. But in King County, cases have risen to new highs, averaging close to 400 a day this past week. And this week, hospitalizations are up 30% over last week. COVID-19 is a viral wildfire, and we are the fuel. Everywhere we gather, especially indoors, at work, or socially, in groups for any purpose, recreation, worship, dining, social event, or party, which is a risk for spreading COVID-19, and stepped-up precautions are needed. Let's not throw more human logs on the fire. We knew from the start that this pandemic posed a relatively long-term challenge, and for this reason, our response requires endurance. It hurts to run a marathon, but there will be a finish line when we can relax in the future. Yesterday, we heard promising good news about a vaccine study underway that could help us bring this outbreak under control sooner. But it won't be soon enough, and even if one or more vaccines become available, we'll continue to make COVID safety part of our lives for the time being, every day, including at work, socially, and in the community. I'll say it again, at this time, we all need to cut back on non-essential activities and contact with others outside the home, make interactions brief, wear masks whenever with non-household members, avoid crowded indoor spaces, pay attention to increasing ventilation, and generally do things safer, smaller, and smarter. No matter what we do, it could take weeks or more to turn this current COVID trend around. The cases and illnesses we're seeing today are a direct result of our behaviors and activities a few weeks ago. And what we do today determines where we will be 2 to 3 weeks from now. The status of our healthcare system will be the best indicator of whether additional, more directive measures may be needed over the coming days. Thank you, and I'll turn the podium back over to our moderator.
Thank you, Dr. Duchin. Last presentation today will come from Michele Roberts, Assistant Secretary for the Division of Prevention and Community Health.
Good afternoon, everybody. Like Corey said, I'm Michele Roberts, and I lead the COVID vaccine planning work at the Department of Health. Dr. Duchin just mentioned that there's a long-term ray of hope around COVID vaccine. We're continuing to make steady progress in our planning for COVID-19 vaccines and are hopeful to have a safe and effective vaccine against COVID-19 that will start being available before the end of the year. We are encouraged by the news Monday from one manufacturer about some initial estimates of high efficacy and low safety issues. But we want to acknowledge that how important it is to remember there is still a lot to learn about how well the vaccines will work and how long they will provide protection. Many vaccine candidates are in clinical trials, and the manufacturers must still apply for an emergency use authorization from the Food and Drug Administration. The EUA application will provide the clinical trial data for review, which brings me to the topic of vaccine safety. We know that vaccine safety is a big priority for the people of Washington. The department has spent the last month engaging with communities and groups that are most impacted by COVID-19. And we've heard that Washington communities have questions and concerns about the safety of COVID-19 vaccines. We want to give our communities the highest confidence that they are getting clear and accurate information about COVID-19 vaccines when they're available that can help them choose whether or not to get vaccinated. Vaccines are held to the highest safety standards, and the COVID-19 vaccines will be no different. And finally, on our allocation around COVID-19 vaccines. Estimates have varied regarding the amount of vaccine doses in Washington we will initially receive. And there are no updates yet from the federal government about our allocation or timing of when we will receive vaccine. We'll know more on timing once a manufacturer submits an application to the Food and Drug Administration. So that's it for now for me. Thanks, Corey.
Thank you, Michelle. Next, we'll move into the Q&A portion for today's briefing. Media have reached out ahead of time to get into the queue to ask questions. We will allow follow-ups, but be mindful that we have a long list today. So with that, if we're unable to get to you by the half hour, we will follow up with you in email, or you can reach us at doh-pio@doh.wa.gov. So to begin today's Q&A, I'll open with Rachel LaCourte, Associated Press. One moment, Rachel.
Hi, this question is for Dr. Lofy. You mentioned that if the trajectory of cases doesn't change, additional actions may need to be taken. Is there a time frame that you all are looking at in which those decisions would have to be made, and what might that look like?
Sure. So, I mean, what I can start by saying we're working really closely with our healthcare system right now, to really understand what they're experiencing and how what they're experiencing is changing every day. We look at this data every day. We talk about this every day, the time will come when the time will come. As I mentioned, we do not want to take further actions that will further hurt our economy. But unfortunately, if we continue on this trajectory, at some point we may need to.
And then if you could talk just a little bit more specifically about what tweaks might have to be made. And then also the latest state-specific White House report released this week says that community spread can only be interrupted through proactive testing of those without symptoms in order to identify and reduce asymptomatic transmission. Is there or will there soon be a plan for that in counties that are currently seeing the most dramatic increases in cases?
So in terms of what steps might potentially be taken, I guess I can say that everything is on the table at this point. We are talking about really all potential actions that we could take, some more dramatic than others. We don't want to take any. We really hope that people can change their behaviors because, quite frankly, it's our behaviors that determine the trajectory of disease that we're on. And so, the point of this, this afternoon's conference is really to make sure that people understand that, remind people that this is all in our control, and encourage people to really double down and, change their behaviors and, take the actions that you've heard about this afternoon. I think your second question was about proactive testing of people who are asymptomatic. Is that correct?
Yes, Kathy, it was testing people without symptoms.
Yeah, so we are, there is testing going on in long-term care facilities of people without symptoms. We're talking about doing more pilots of testing in people who are asymptomatic. We will continue to try to test as many people as we can. I truly believe that people, wear their facial coverings, maintain 6 feet of distance, and they can limit their social interactions. We really can decrease and get tested as soon as they have symptoms. That can really work to, decrease transmission. But we will continue to try to, talk about places where we can do routine testing, in people who are asymptomatic. And I don't know if any of the local health officers have anything to add to that.
This is something Chen should add to that. I think as with any infectious disease, think about it. STDs, sure, we can catch the people with STDs so they don't infect other people. But if it was you, wouldn't you rather not get STD in the first place, right? So, they're both strategies that we use. we want to prevent people from getting the illness in the first place, then we also want to find people who have the illness and prevent them from spreading it to other people. But ideally, we prevent people from getting the illness in the first place.
Next, we'll go to Ann Dornfeld with KUOW.
What message do you have for school districts that are considering expanding in-person learning at this time? I reported yesterday on one district that's planning to reopen for an additional grade next week.
This is Lacy. I can start, and any locals that are contemplating this can certainly add. First thing, this is a local decision, and it is a very complex decision that involves weighing many benefits and risks. That includes managing our disease activity for COVID and protecting the students and staff in those school buildings as well as the communities around them. But it also includes considering the educational and health benefits and losses that are experienced, whether families and students are learning at home or learning in school buildings. We do ask locals to look at a number of things beyond just their disease activity. That is a very, very important factor for what the risk is in the school environment. But it is not the only thing. We encourage them to look at the trend of their cases and their hospitalizations in particular. And while you're hearing that disease rates are increasing across Washington, there are a few communities in Washington that have flat or decreasing rates. And again, looking at those other impacts, including mental health and the ability to do distance learning. We're also learning a lot about the virus and schools, and we are seeing promising signs that children, and in particular younger children, can return to school buildings safely when there are robust safety measures in place and the ability to quickly respond to cases and curtail outbreaks.
This is Chris Fitters in Everett with Snohomish Health District. I would be one of those localities where we have increasing case rates in the community, and we have school districts opening up to in a serial, incremental fashion to the youngest learners and other students of other ages with high needs or special health conditions where they really need on-site learning. Now, and based on the state's framework that emphasizes in-person learning in cohorted, that means fixed groups that are only on campus maybe half the time and are engaged in all these prevention measures from start to finish, screening on arrival at school or before getting on the bus, wearing face coverings, social distancing, protection for the teachers, and all that. Our experience has been, and I think it's been also seen statewide, is that while cases do pop up in the school environment because there's COVID in the surrounding community, we're not seeing sustained transmission. We're not seeing outbreaks continue to run through schools, and I suspect that we'll continue to learn what Lacy mentioned, which is that these younger age kids appear to not be as efficient transmitters as older kids. So, and last, that Institute for Disease Modeling report last week, I think, also underscored some of these findings, that with appropriate preventive measures in place and focusing, I think, on younger kids, we can safely get some in-person learning done for the kids most likely to benefit from it and least likely to foment transmission in the school, much less in the community. And so far, that's been our experience here. We have not seen an impact of school activity on the community-wide COVID rates.
Next, we'll go to Jerry Kornfield with the Daily Herald.
I was just wondering on some of the actions on the table, long-term care homes. Are you looking at reimposing restrictions on visitors from the outside to the long-term care homes? And it seems that's a place where cases are on the rise.
No, go ahead, Lofy.
Yeah, unfortunately, we don't have our long-term care experts on the phone today, but they do have a phased plan. And, you know, they have, I heard the other day that they're all almost essentially back at their, I think, earliest phase with their most stringent restrictions because of all the disease that's in the community. And I just don't exactly remember all of the, you know, the visitation, you know, restrictions at the different phases, but we can get that answer to you.
We'll follow up in email. Next, we'll go to Anna Boyko-Wayrock with KUOW.
Hi there. A question for the governor's office. Since the virus is really accelerating, as everybody is saying, what is stopping the governor from imposing new restrictions now before it can spread anymore?
Well, nothing's stopping him. What the doctors are talking about today is what we think is the important next and immediate step. You know, the governor has addressed this several times, but, you know, he believes things such as masks have made a difference. Not enough people are wearing them. Not enough people are socially distancing. As everybody on this panel today said, you know, the home inside the house, visiting somebody or having somebody come to visit you is what seems to be spreading. And so this is the beginning of what I think you will see leading into the holiday season, a very concerted effort to get people to recalibrate and to take this seriously and to listen to the experts here and look at those charts and do something about it. There is a lot that each person in the state can do to help protect themselves, protect their families, and protect their communities. And frankly, that is so much better for everybody than trying to shut down the economy. There are downsides to shutting down the economy that even many of these public health experts would tell you is not ideal. You know, you don't shut down in the spring when this thing's hit and just stay shut down. That's not good either. So there's a real opportunity here for people to take it more seriously than they are, to get over sort of the awkwardness, if there is an awkwardness, of telling loved ones, no, sorry, either you need to wear a mask or I need to wear a mask or we can't see you. Or as you know, you heard Dr. Chen talk about, you're going to have to make really difficult personal decisions. Maybe I won't go to that birthday party. Maybe I won't see the extended family on Thanksgiving. And that's just one Thanksgiving. So nothing is stopping the governor. You're going to hear him talk about this more even later this week. He is extremely concerned about this. He's been talking to DOH about it a lot and talking to us about it. But this is not a case where he's got, you know, some secret plan in his jacket that he's ready to lay on the table. This is the plan. We need people to take it seriously. They need to recalibrate. They need to protect themselves and protect their community. And that's the way both to preserve the public health and continue to help the economy recover. If that doesn't happen, if people don't take it seriously, if people still push back on masks and social distancing and crowd size and parties in your house and frat parties and everything else, then we're going to have to go and try to find something else to do. And that comes at a cost. It comes at a cost greater than just the economy. The disruption on a family when we do that is real and it's lasting. So these decisions are never made lightly. And we've made a transition through the summer into the early fall where we moved away from some of the economic restrictions and moved to personal responsibility. And we traded wearing masks for getting some businesses open, but that's not a guarantee that that'll last forever. The numbers are alarming, as every doctor on this panel told you today. You can see the charts that Dr. Lofy laid out. And we know that holidays create problems. And as it gets colder, we know people will be more likely to stay inside. Thanksgiving, Christmas, those are the holidays where you pack your house full of people. You just can't do it this year.
Next, we'll go to Ariel Dreyer with the spokesman review.
Great, thank you. I'm hoping someone on this call could help explain what happens to a local health jurisdiction when they're overwhelmed with about 100 cases a day for days on end, like's happening in Spokane County right now. And can that lead to backlog contact tracing and potentially more community spread?
I can briefly start and see if one of the locals wants to share from their experience. But yes, we all have capacity limits. We have been ramping up at the state to provide some surge capacity to locals when they reach those limits. And a number of them have reached out to have us cover some of their cases. At this point, we haven't reached the state's capacity yet. But the next step would be if we do hit the combined capacity of state and local public health, we would start prioritizing our investigations so that we can do the very best we can with the resources we have.
Yes, and this is Jeff Duchin from King County. I would also echo that case and contact investigation is most effective when the case numbers are relatively low, and they become increasingly less effective with higher case numbers as we get to fewer of the people and get to them in a less timely way. So, the idea is to suppress the transmission of the virus to the greatest degree possible, and then use your case and contact investigation resources to track as thoroughly as possible and as quickly as possible, a manageable number of cases and their contacts. The more that there are, the harder that is to do. And you're absolutely right. If people aren't isolating and quarantining in a timely way, that leads to more transmission. And don't forget, the number of cases that are reported just represent a fraction of those that are out there. So it's hard to estimate precisely, but there are at least 4 to 5 times more cases occurring than we are documenting. And I'd also like to get back to Anna Boyko-Ryrock's question for a sec and Mr. Postman's response. I mean, clearly, we all prefer voluntary compliance with what needs to be done. Unfortunately, we don't have the luxury of a lot of time to wait and see what works. And as I mentioned, our healthcare system is going to be our most sensitive indicator of whether we need to move more aggressively forward with more directive measures very quickly. Over the next couple of days, we'll be watching those hospitalization numbers and reaching out to our healthcare system leadership. And we want to understand from them what they're feeling, what the stress level is, what their capacity is, and where they think we're headed. Because don't forget, it takes weeks to turn around a trend. And if we see this trend is going in a direction that's stressing our hospitals, we're going to need to act pretty quickly.
This is Anthony Chen. Let me add to the response here. As Jeff pointed out, case investigation and contact tracing is a key public health intervention. I mean, when you look at diseases through history around the world, I mean, Ebola, other things, when there's no cure, when there's no vaccine, we have to rely on public health interventions, and case investigation, contact tracing, quarantine, isolation are critical to that. In Pierce County, we're kind of fortunate we don't have as big of a disease burden as King County does. We also are bigger and have more resources than Spokane. Fortunately, early on, we did projections on what a 2, 5, 10 times increase in workload would be, and we were able to get the resources from our county through the CARES funding. We feel like we're sitting in a good spot now in our capacity. But I do want to say, this is not the time for politics. It is not the time for conflict between politicians and health officers. It is not the time for arguments about whether the funding should be there or not. Public health is the only thing standing between us and disaster. Okay, and so I know there are lots of tensions, everyone's tired, but this is not the time for argument. We've got to resource public health properly. We have to put politics aside, put personalities aside. We've got to work on this together.
Next, we'll go to Ryan Blethyn with the Seattle Times.
Yeah, hi, thank you. Has there been any consideration on rolling back the counties and the Safe Start plan? And if so, when could that happen, given what we're going into with the holiday season and numbers increasing like they are?
This is John Weisman. I think, as Dr. Lofy said, we are constantly looking at these metrics and looking at our plans. As I think we've said, nothing's off the table. If we feel like that might be helpful, that's something we would definitely consider. We are taking close looks at our plans. Constantly talking to partners about how we can all work together to stop this pandemic from growing in our state right now. So I think the best prevention to that from needing to happen is everybody taking the advice of the public health experts that you've heard on this call.
Next, we'll go to Keith Eldridge with COMA.
On the Snohomish Health District call this morning, Dave Summers, executive, said that there is a potential for a rollback to a stay-at-home order. Since we're in dire straits right now, why not institute a stay-at-home order today? Because it's going to take a while for this whole thing to take effect.
Let me try to address it again. Because it wouldn't be necessary if people were able to do the other things that they can do immediately right now on their own. It doesn't mean we won't come to some sort of restriction as we saw in the spring. We don't know, but I will just remind you that when we institute those sorts of things, the questions we get then are, why are you doing these things? People don't like it, and there's a COVID fatigue that sets in, and people told us that from the very beginning. I remember hearing Dr. Duchin talk about that many months ago. There's only so much time where people are really going to listen to these things, and we've seen that. So we need to try something here. We need to try it right now, particularly as we go into the holiday season. If it continues to get worse, if people don't do the basic common sense things that have been laid out in detail here today, then we'll think about what those next steps are in consultation with these health districts, local health jurisdictions, and others, and figure out what that is and what works. But I think right now, what we're trying to say is that you and everybody has the power to help avoid more onerous restrictions. And the question is, will people take advantage of that opportunity and work to protect themselves and their family and their friends and neighbors and loved ones? And if not, then we'll have another press conference like this where we're talking about restrictions, whether that's stay at home or any of the other things we've seen in the past. There's only so many things you can do. And we're not done. Like I said, the governor will be talking more about this in the coming days. You're going to hear, I hope, a constant message from now through the holidays about what needs to be done, and it will calibrate to the case count. And if they keep going up and the hospitals, max out, we're going to have to do something. One of the doctors mentioned that is the best measure, and that's where we started this early in the spring, was how do we maintain the integrity of the hospital system? And then you remember after we did that, then we got those questions, which was, well, wasn't that the only reason why you did all these things? Can't we open everything back up now that the hospitals are okay? Well, no, because guess what? They're filling up again. So we're watching that carefully. We get reports on that every single day. Hospital capacity, ICU, COVID-like symptom reports, all these things. We watch these. And if Washingtonians don't take this seriously now and take it into their own hands, then we, of course, will find more. But it doesn't need to happen today. And so to answer the question as directly as I can, the question is, why don't we do it today? It's not necessary today if people do what they can do themselves.
Final question comes from Hannah Scott with Cairo.
Hi, can you tell me how close are we to exponential growth at all? And also, are you following any of the metrics, or did you ever stop the mobility and things like that to see how people are traveling in the state?
So this is John. I can start that. So I think the answer to how close are we to the exponential growth is we're much closer than we were 4 weeks ago when we started telling people the fall surge seemed to be occurring. And as Dr. Lofy said, the slope is increasing right now to a point where we are very concerned, if not alarmed. And all you have to do is look at those data in the incomplete area of the graph and see that there is more to come. So that's why we, have all of us on this call today to really show a force of the local and state public health system coming together to say to the public, pay attention now, redouble your efforts now, reduce your social contacts now, and don't let your guard down. Reinforce everything that we've been suggesting you need to do, and because we're very concerned. One just has to look at states across the United States to see how quickly this explodes. And a number of weeks ago, we were at 500 cases a day. Now we're over what we were in the summer surge of 800 some cases a day. We're over 1,000 cases a day. So I think we're raising the alarm bells for the public, for you all as well, to let the public know today. Take action today. Plan today. If you are thinking of future social gatherings, you need to rethink those. We want you to plan for Thanksgiving. What are alternative plans that you can put into place than simply gathering at someone's home with a large meal with everybody unmasked? That's dangerous in these conditions. We just are calling attention to that to people right now. Take action today.
With that, I would like to thank all of our panelists for making time today and for all of you for joining. Special thanks to tvw.org for hosting the live stream, as well as past recorded briefings for the COVID-19 response. You can also visit the Department of Health's YouTube account to find other COVID-19 media briefings that have been recorded. This concludes today's briefing. Have a great day.